What if your next nurse was a humanoid robot created by Elon Musk? Picture walking into a hospital and being greeted by a sleek, AI-powered caregiver. That might sound like pure science fiction, but it's quickly becoming reality. In today's video, we explore Elon Musk's Optimus Gen 3, a cutting-edge nursing robot that could revolutionize healthcare and support overburdened medical professionals around the globe. Welcome to AI MedX Revolution, where we dive into the latest breakthroughs at the intersection of artificial intelligence and medicine. Elon Musk first introduced the concept of the Optimus robot a few years ago, and over time it has evolved into the more advanced Gen 3 prototype. Standing about 5'8", it's designed to walk, lift, and handle items much like a human. Packed with sensors, cameras, and AI-driven software, the Optimus robot can continuously learn from its environment, recognize objects, and navigate hospital hallways without bumping into patients or staff. One of the most intriguing updates for 2025 is the rumored integration of a new conversational AI system called Grok, giving the robot an ability to understand and respond to basic questions or emergency alerts. While that level of interaction still requires thorough testing and development, it points to a future where robots in hospitals could become not just mechanical helpers, but also real-time assistants capable of meaningful communication. The most important feature, however, isn't fancy conversation, it's reliability. In a healthcare setting, where the margin for error is razor-thin, any device or robot must be trusted by professionals and patients alike. Now, you might be wondering why nursing robots are even necessary. Around the world, medical facilities face alarming staff shortages, especially in nursing and elder care. Many nurses experience burnout from long hours and physically strenuous tasks, such as lifting patients or handling repetitive checks. An AI-driven robot like Optimus Gen 3 could assist by taking care of these routine or physically demanding chores, allowing nurses to focus on direct patient care and compassionate interaction, the parts of the job that truly require human touch. Imagine a robot that can help lift and reposition a bedridden patient, monitor vital signs, or deliver basic supplies and medication on time, freeing up precious minutes for nurses to handle critical cases or spend more quality time with patients. Although the idea of robot nurses can feel futuristic, the concept isn't purely hypothetical. Several countries are already testing healthcare robots for tasks like disinfecting rooms, transporting samples, or even providing patient companionship. The difference with Optimus Gen 3 is Elon Musk's ambition for scalability. Tesla aims to mass-produce these robots and drive costs down over time, just like it did with electric vehicles. In a few years, the dream is to see these helpers not only in large, resource-rich hospitals, but also in smaller clinics, nursing homes, and potentially private residences. However, while the hardware and AI are making giant leaps, widespread adoption will hinge on many factors: official regulations, hospital policies, cost considerations, and most of all, acceptance by healthcare professionals and the public. It's also important to note that robots don't replace the empathy and emotional intelligence that nurses and doctors provide. A nurse can sense discomfort from a glance or a slight tremor in a patient's voice, signals an algorithm might miss. Ideally, Optimus Gen 3 would complement healthcare teams, taking on labor-intensive tasks and giving human caregivers more time to address patients' emotional and psychological needs. That collaboration could relieve some of the stress and burnout that frontline workers face, especially in high-demand environments. In practice, a day with Optimus Gen 3 on a hospital ward might look like this. Each morning it receives a digital list of tasks: fetch supplies for patients in rooms 101 through 105, deliver medications at scheduled times, and assist the physical therapy team with patient transfers. It navigates autonomously through corridors, using sensors to avoid collisions. When it reaches a patient's bedside, it might check heart rate or temperature using non-contact sensors and quietly notify the medical staff if anything is out of the ordinary. Throughout it all, human doctors and nurses remain in charge, supervising and stepping in whenever a task requires direct human judgment or empathy. The possibilities go beyond clinical settings, too. With an aging population, many elderly people live alone and need daily support. A home-based version of Optimus could handle basic chores or offer remote medical checkups, extending the time seniors can live comfortably in their own homes. While this vision might still be years away, developments like Musk's 2025 update push that future closer to our doorstep. Of course, there are challenges. Safety testing is paramount. No hospital will deploy a robot at scale unless it's proven safe. Cost is also a factor. Even if mass production reduces the price, hospitals and families must justify the investment. Ethical and privacy concerns arise whenever cameras and AI enter personal spaces. And although we can theorize about a seamless robot-assisted future, real-world adoption often moves slower than we'd like. That said, incremental progress is happening, and each new prototype, like Optimus Gen 3, brings us a step closer to having reliable AI helpers alongside nurses and doctors. So is it hype, or is it a healthcare revolution in the making? The reality is somewhere in between. Optimus Gen 3 is a bold leap forward, and if the technology matures responsibly, with medical experts, policymakers, and AI developers collaborating, these nursing robots could significantly reshape how we experience healthcare. Imagine less waiting time, more personalized attention, and medical teams that are not constantly short-staffed. The goal isn't to replace human empathy, but to amplify it, using AI to shoulder the heavy lifting and routine tasks. If you found this exploration fascinating and want to stay on top of the latest breakthroughs in AI healthcare, make sure to subscribe to AI MedX Revolution. We dive deep into emerging medical technologies, so hit the notification bell to catch our next video. In the comments, let us know what you think. Would you feel comfortable receiving care from a humanoid robot, or does it raise concerns?